The time is 16 minutes past the hour. Now, it seems that children are paying the price for sugary diets, as latest figures show more than 1 million rotting teeth are being pulled out every year. Poor dental care and sugary diets are being blamed for the 12% increase in teeth extractions amongst under 18s in the last 5 years. So what can be done to treat the rot? Well, Elaine Willcox is at a dental surgery in Bolton. Elaine.
Yes, good morning, Penny. It can be a constant battle getting kids to clean their teeth. With me is little 6-year-old Lewis and his mum and brothers. Now, Lewis, you are very good at brushing your teeth, but sometimes you forget, don't you? Well, he's going to show us how to brush his teeth properly. But with me, too, is the dentist here, Dr. Monik Vasant. Now, you are seeing more and more young people coming in with tooth decay. Who's to blame?
Well, it's very difficult to just blame one person. Obviously, tooth decay is caused by bad diet, not brushing properly, not using the right amount of fluoride, and maybe not going to the dentist enough, and obviously possibly not receiving the correct advice when going there.
Now here you've got interactive screens for kids, you've got models and guides. Do you think dentists, is it vital that they do this preventative work?
Well, it definitely helps a lot, and kids really relate to it in a big way.
All right, well, Lewis, you're going to show us how to clean your teeth properly. The dentist is watching, lots of big round strokes there. A bit faster, is he doing it right?
Just needs to go a little bit faster, but yes, that's nearly
right.
there.
You start at the back and you go all the way around. And you also talk about spiders to children, don't you?
Well, we substitute the word plaque for spiders, and kids really relate to it a lot more. And the first thing they do when they get home is scrub their teeth for a good 10 or 20 minutes.
All right, and very quickly, Mum, you've got 3 kids. Stella, how difficult is it getting kids to clean their teeth?
It's really difficult. I don't think they'd ever do it unless I said, please, brush your teeth, have you brushed your teeth? And I have to constantly go in and check that they've done it. Yeah,
all right, that's brilliant. Well, Stella, watch your children clean their teeth so she knows that they've done it. Back to you.
Elaine, thank you very much. I'm joined now by the Chief Dental Officer, Barry Cockcroft. Good morning to you. What's going on here? Why are the levels of rot still so high?
Well, certainly the levels of decay are not increasing. We introduced new ways of working for dentists in 1997, 1998, and the level of tooth extraction has actually fallen by 14% since then. It's been very difficult this week because the data that was produced is very complex, and it actually excluded the dentists who've been working in this new way since 1997 and growing, actually. So the data in the base year actually didn't contain the activity by the dentists working in these new ways. So it's a very misleading comparison. Say, over 10 years, the number of extractions have actually gone down by about 14%. And dentists are actually taking some very unfair criticism this week, I think. I think they do a fantastic job.
When you look at those headline numbers, you just think that
that was very disappointing. I mean, as you see, Dr. Vasant, they're doing a really fantastic job. It's really difficult. The real problem is that the sort of very negative media coverage actually sort of didn't focus on the really good stuff that we announced that week. That there are now more dentists providing NHS treatment, and in the last 12 months about 750,000 more people are starting to access a dentist. It came from a very difficult position, but it's really improving rapidly now. And I think the oral health message is that tooth decay is 100% preventable if you do the right thing, and you saw a good example there in that piece. We have very good levels of, very low levels of tooth decay in this country compared to the rest of the world, and that's really good.
How do we compare to Europe then?
Well, we've got probably amongst the best in Europe, certainly better than most countries in Europe. And the real thing is that tooth decay is 100% preventable. If people do the right thing, brush their teeth twice a day, avoid snacking on sugary things all the time, and go and visit the dentist and get the sort of good advice that you saw Dr. Vasant there giving his patients.
And of course, brushing your teeth, there is a way of brushing your teeth as well. You just can't, like the Dr. Vasant there was saying, a little bit faster. But in fact, it's not just about fast, is it?
No, I think it's not. I mean, there's some things that people don't know. It's use the right strength fluoride toothpaste, a family strength fluoride toothpaste. Don't rinse out after you brush your teeth. Spit out and allow the rest of the toothpaste to stay on your teeth to soak in so that the fluoride can act. And do it for 2 minutes as well. That's quite one of the other things is you should brush your teeth for 2 minutes, and 2 minutes is actually quite a long time, and people don't realise. I mean, it's been getting better. It's been getting better for a long time. When I qualified as a dentist in 1973, levels of tooth decay in 12-year-old children, each 12-year-old child, and these are permanent teeth, had about 5 decayed teeth. Now the average is less than 1. The problem is that about 60-odd% have none at all, and the people who get the decay get too much, and that's where we need to focus things.
Barry Cockcroft, thank you very much.
Now, we have heard the message from dentists for years, haven't we? Brush your teeth twice a day, but it seems that message is not getting through. Children are paying the price of sugary diets, as the latest figures show that more than 1 million rotting teeth are being pulled from youngsters every year, I should say. Gosh, there'd be a lot of it every day, wouldn't it? Poor dental care and sugary diets are being blamed for a 12% increase in teeth extractions amongst under 18s during the past 5 years alone. So, what can be done to improve our children's teeth? Let's cross now live to Elaine Willcox, who's at a dental surgery in Bolton with a poor unsuspecting lad who's 6 years old and in the dentist at this time in the morning. It's not very nice, is it?
Yes, absolutely. It can be very, very difficult getting children to clean their teeth, but nobody wants to see a child sitting here having their teeth out. This is the Picton family, and 6-year-old Lewis has been very brave. How many times does your mum have to ask you to clean your teeth a day?
6.
6 times. And do you always clean your teeth? Not always, but most of the time you do, don't you? That is very, very good. You have got beautiful teeth. Now, your big brother Joe is here. Just show us how. We've just been shown how to clean your teeth by the dentist here. Big round movement starting at the back and moving in. Now, how long do we have to clean our teeth for?
3 minutes.
Was that a shock to you?
Yeah, it was.
Now, Tom, do you think let's be honest, you clean your teeth for 3 minutes a day?
No, but I'll probably do it for 2 minutes.
For 2 minutes. Well, we worked out 3 minutes. We sang Happy Birthday and we had 20 rounds of Happy Birthday. Now, Stella, you've got 3 boys, busy enough. Do you think they do? Can you get them cleaning for 3 minutes a day?
Sounds a long time. I think I'm definitely going to have to check what they're doing, because I wouldn't brush them unless I told them to and watch them do it.
And is that the key? You have still got to watch them and check every day that they've cleaned their teeth?
Definitely, yes, yeah.
All right, well, it can be very difficult. A friend of mine saw a mum cleaning her kids' teeth at the bus stop. Back to you.
There you go.
Really, that's
forgot.
dead keen.
I remember once, actually, I got to school and forgot to brush my teeth, and Mum made me go home. There you go.
Yeah,
that's about 6.
well, it's all paid off, you see. It's all paid off. They're lovely.
Apart from my snap one when I was about 8, coming out of a swimming pool, front teeth.
What did you do?
Yeah, I dived into the shallow end. See, never do that. See, I'm a bit thick. That's the reason why. But
Yeah.
they're quite scary, aren't they? That's the problem.
It's all these sugary drinks, and there's so much sugar in food now, and also eating between meals. That's what we were told. I got told off by my dentist. David Stroud, morning.
He's watching this morning. Well, let's go back to Bolton, actually, and speak to dentist Dr. Monik Vasant. He's got some good tips for us. Good to see you this morning, sir. So what kind of problems are you seeing in children's teeth who are coming into your surgery?
Well, we're seeing children coming in from very young ages with teeth that are needing to be pulled out because they can't be filled anymore. And these just aren't just new patients. These are patients who are coming for regular appointments. So it is a bit of a problem at the moment.
An awful problem. I mean, 1 million teeth a year being extracted from kids. I mean, it's horrible, isn't it, thing to have to do? And it's jumped enormously over the last 5 years. So why is it getting worse, do you think?
Well, it's difficult to pinpoint accurately the cause, but however, there's several causes of tooth decay, but the main factors are improper brushing, a poor diet, insufficient use of fluoride, and not visiting the dentist regularly. They're the main things that need to be dealt with first.
OK, so we need to focus maybe more on preventative work rather than kind of what happens within your dental surgery. What needs to change? More focus in the home with parents, more focus at school? What would you like to see happen?
Well, I think all those things can help. I think parents have got to take the first responsibility. I think encouraging the children to brush their teeth, supervising it is very important, and, you know, positively encouraging the children when they're doing something right is always a good step. And also,
it's hard, isn't it, getting kids to clean their teeth. What top tips would you give to parents watching this morning?
Well, the first thing is always be there when they're doing it, at least until the age of 7. Brushing in a mirror and standing behind the child while they're doing it. Also doing it for them helps quite a lot. Making sure they're using a fluoride toothpaste after the age of 3 months. And just visiting the dentist regularly.
Yeah, and also
and watching the diet as well.
And maybe making dentist trips a bit more pleasant, because you can be a bit scary, can't you?
Well, some practices can be, but not ours, thankfully. We've got some very ingenious technology here that makes the patient feel a lot more at ease.
Yeah, you've got some good cartoons going on behind you there, haven't you? Thanks very much for talking to us this morning. I hope you've brushed your teeth as well. Dr. Monik Vasant. talking to us there.
Claire's here with the weekend